All right, I think we'll get going. So our final panel of the day is asks a number of important questions. It's consuming patient data, benefit, or burden. And it's a lot of things that we talked about. There's a lot regarding data today and collecting data. But do patients really want it? Is it really gonna help them improve their health care? As they demand, access to their data, what are the implications to the medtech industry? And how can we all help shape the Internet of Health? It's happening. We need to be part of it to make sure it's happening in the right way and patients are getting the right data that they need to get the care, the best and the highest quality care that they deserve. And so I'd like to welcome Harveen Sethi, Harveen, we just practiced that. Harveen, and I'm going to read this because it is very important and impressive. She is a technology, healthcare strategy, and marketing executive turned digital health VC. So we're so pleased to have Harveen here. She's got a background in product and business innovation. She's passionate about predictive analytics and connected devices to improve healthcare. And so without further ado, I'd like to introduce Harveen for our final panel of the day. Actually, sorry, one more thing that Deb asked me to remind you all. We've had a couple questions about the Twitter feed. People want to know how to tweet. So where would I find that? Oh, it's in the app, yeah. So if you actually go open up your app and there's one section on social media, there are actually 2 Twitter sections in there. You can find our handle and tweet all you want. So thank you. And really, here's Harvey.
Thank you for that very nice intro. So, of course, I have the envious position of moderating the last panel of the day before cocktail hour. So, thinking of this in mind, we are hoping to offer you a most exciting session to wrap up the day with hopefully a provocative conversation around patient data and the benefit and burden. So, by way of introduction, before we get started, I wanted to share a little bit more about why I'm so passionate about digital health. So, prior to VC, I was at Accenture and a short stint at Google, actually while Missy was at Google Health, before joining Medtronic. And at Medtronic, most recently had focused on product innovation and business innovation across the care continuum, looking at different solutions for predictive diagnostics. And it always struck me that there was an opportunity, that there's so much that we could do with data. Generating data, think body computing sensors, aggregating data, and then analyzing data for better clinical decision intelligence, for improved outcomes, as well as partnering with patients to own their health and understand their data. So with that said, we are super excited to talk about all the sort of opportunities and challenges that come with the space of all the data generation in the space today. And I'd like to kick it off with introducing a wonderful, amazing panel of such amazing women, very diverse perspectives. And I'll actually have each of them introduce themselves, and then we'll get kicked off with the panel.
Perfect, thank
you.
you.
So Julia, would you like to start off?
Thanks. My name is Julia Stramberg. I'm the Vice President of Global Marketing for Covidion's patient monitoring organization. And before I go any further, I am exceptionally proud to not only be a leader, but a woman at Covidion. So, very proud. So let me tell you a little bit about the patient monitoring organization. We're about $1 billion that is dedicated to integrated physiologic monitoring to enhance clinical value and reduce unnecessary cost, today really in the acute care environment. Our portfolio is made up of 4 big brands that I'm sure all your clinician customers will know. Nellcor Pulse Oximetry being our hallmark brand. And each one of these brands supports protecting really the brain, the heart, and the lungs. But as a med tech player, we know that we have an evolving role to play, not only in the acute care environment, but really across the care continuum. And so in early 2014, we already talked about it, the patient monitoring organization acquired Zephyr Technologies. Zephyr Technologies is in a wireless ECG and accelerometry monitoring solution. And what's really interesting about Zephyr is their roots were really grounded in both the military and pro athlete markets. In fact, we just sold a solution to the Red Sox, so hopefully this coming year, they'll bring it home. But why is that important? From a military and also a pro athlete market segment, the need to really drive reliability and durability are truly paramount when you talk about monitoring devices. But what's more important is the wearability of that device. And that really allows us to think about the care continuum and going from being a patient to really a consumer of healthcare goods. So in 2013, Zephyr received Class 2 FDA clearance, such that now we can actually proactively participate in monitoring in and out of the hospital. And I'm really pleased that we just announced, as we talked about earlier, actually, we have a strategic agreement with Genea, who is the consulting analytics arm of Capital Blue Cross Blue Shield, and with the whole intent of putting our Zephyr Home solution into the at-home Genea product. And I will pitch for them as well. It's the Theon product. It's pretty impressive. And the intent is to really capture CHF patients across the care continuum. So in panels previous, we really talked about CHF patients and really monitoring and really reducing the burden of healthcare with those patients. And so hopefully our partnership and our solution will take hold. So thank you.
Thank you, Julia. Anna?
Hello, nice to meet you all again, since Missy called me out earlier, out of turn. But my name is Arna Ionescu. I'm the Vice President of User Experience and Design at Proteus Digital Health. I'm really excited to be here today. Just as a story, I'm not going to name which one, but one of our male executives yesterday, he asked me, I told him I'm coming to this conference today, and his comment to me was, "Oh, I totally want to go. A room full of chicks. I can find a date." And my jaw, like literally, I think it not only hit the ground but bounced. And I looked at him and I said, "That is the most offensive thing you have ever said to me." And that stopped him in his tracks. But it's pretty amazing to have a group of women like this, because there's, those things happen really regularly. So as I said earlier, Proteus Digital Health is part of this wave of putting the internet on the things around us. So if we look at kind of the general progression of technology, first things went on the internet, transforming things like publishing and commerce. Then the internet became the thing with places like Facebook, and that changed the way we communicate, and now the internet is going on the things around us. If you're looking at things like the internet going connected appliances, connected cars, and what we're doing is putting the internet on medicine. We think that healthcare is ripe for innovation, for disruption. We think that information and digital technology will absolutely be a part of that. And our goal is to bring information to the most frequent way that you engage with your health, which is taking your medicine. Talked a little bit earlier about how we do that. We have a little sensor that captures information every time you take your medication, and I look forward to telling you a lot more throughout this panel about how we're turning the data that we collect into things that are really meaningful and valuable and game-changing.
Good afternoon, everyone. I'm Lena Cheng. I am a physician by training and was board certified in internal medicine. I am currently working in business development at Doctor on Demand. Doctor on Demand is the next generation video telemedicine company. We have an app that allows people to video connect live and on demand to a physician for diagnosis, treatment, and to get prescription medications. And it costs $40 for a 15-minute visit. So I'm really excited to share my perspective on what we've heard from our users. What's interesting is that when we first launched, we actually marketed directly to consumers first because we wanted to ensure we had a product that people really loved to use, that was user-friendly, and I think importantly, that people were willing to pay $40 for out of their own pocket. And I think proving that organic consumer adoption and engagement first has naturally pulled in the interest of the enterprise audience. So for us now, when we know that when employers, large health systems, large medical practices and hospitals see that market demand from end users, it mitigates the risk of rollouts into their own population. So we've been seeing that a lot of demand from those groups. So I'm excited to share my perspective today. Thanks.
Last but not least, it's the lawyer. I have the distinction of being the only lawyer on a panel today. I'm somewhat proud of that. Before I was a lawyer, I was a data scientist. I actually have a PhD in population biology, and it's driven a lot of my current interests as a lawyer. I'm an intellectual property lawyer at the law firm of Fish & Richardson. We do almost exclusively intellectual property law. My focus has been historically over the last 10 or 12 years in two relatively separate domains. I do all this work with software companies, and then I do all this work with pharmaceutical and life science type companies. And never the twain shall meet, or so I thought, and here we are today, and I'm really excited about what I'm seeing in the marketplace and in the business world, because I think those two have really come together, and they're coming together in what we're calling digital health. I recently founded our digital health law practice. It's one of the few in the nation. I'm sure there will be more, but we're basically offering services relating to not just intellectual property, so not just getting your patents and your trademarks and your copyrights, but also some of the regulatory counseling issues, counseling on issues relating to privacy. And all of these factors are important because I think that they're going to help us define how digital health kind of carves out its space, how the ecosystem is fit together. And so I'm really excited about being a part of that. My personal practice involves counseling in those areas. I'm actually a prosecutor. I do mostly litigation now. I'm actually happy to say I just filed one of the first Internet of Things lawsuits. Wasn't in digital health, but yeah, it's pretty cool. Anyway, I'm really happy to be here.
Nice.
It means we're real.
There you go.
So, perfect segue into the IoT of healthcare. As we live in a digital health world, we see more and more connected health devices ranging from consumer-facing quantified self devices such as Fitbit, Jawbone, and now Apple Watch, to more clinically relevant digital health solutions from remote cardiac monitoring such as AliveCore, iRhythm, et cetera, to mobile health and telemedicine companies, CellScope, Doctor on Demand. Clinical benefits, of course, include efficient diagnostics, better clinical decision intelligence, and improved health outcomes based on continuous monitoring and predictive analytics, even with companies like Ginger.io. But this is just the tip of the iceberg. So as we look into the future, I'm curious to hear what the panelists would have to say. As medtech increasingly intersects with digital health, what do you see as both opportunities and challenges with patients stepping up to their own health, but then also demanding more access to their data, as well as asking providers to use their patient-generated data in their clinical decisions? So Julia, would you like to kick that off?
Sure. I'll frame it up for my fellow panelists who can knock it out of the ballpark.
Yeah.
So I look at the question, and I think the first thing you have to think about is a systems thinking approach. I think that's been a pretty common theme all day today. So we have to think of the system as the care continuum in this context. And so when we think about the care continuum, there's 4 points that I'd really like to make for us to take into consideration. The first is really data management. So it's not only generating the information, but it's also consuming the data. So when I think about it in the context of med device, patient monitoring, even the most recent acquisition of Zephyr, I think about device performance. So what's the accuracy, reliability, the context in which it's measuring? So that's the generation of the data. In addition, patient compliance or patient engagement to the device itself, right? Because there has to be that interactivity. And then finally, something that's incredibly important to us, and we've again talked about it a lot today, is really data security. And where are the handoffs and where are the accept in or opt out? So that's really thinking in the context of data management. Then the second thing is really data translation. So data is just data until you put it in the context of a use case, that allows it to become information or knowledge to act upon. So data translation becomes incredibly important once you actually just get the information in. The second, and we spent a lot of time as we met via telecon about actually patient or consumer education. Can you imagine the amount of information a year from now that you'll be able to receive on pretty much anything about your life, anything about your physiologic state, anything about your behavior? I mean, it is enormous. And if you are enlightened by all the amount of data that about you, can you imagine when you go to your PCP or a caregiver or somebody else and the amount of information that they have to be able to respond to you? So there's certainly this influx of information that requires a patient education side of things. And then finally, clinician engagement. So how do we actually, with the clinical population or the clinician population, actually really engage to make sure that the information that the patients are bringing to you, you can act upon and actually provide the level of education that's required. So just to frame up for the rest of my panelists.
Thank you. So we have generating and consuming data, the patient education required to understand the data, and then how do you move from there to physician engagement? So Arna, I know you feel very passionately about starting off with first, actually, let's understand the patient needs before we start doing anything with the data. So could you kick off that?
Yeah, absolutely. I think there's a pretty significant mismatch between what we can do and actually what we should do. We are able to generate a whole lot of data, and I think that in the coming months and years, we're going to be able to generate even more data. And I think that this idea of just throwing the kitchen sink of data at people and expecting them to use it and to draw meaning out of it, even if it's like really nicely presented in graphs and trends and whatnot, is pretty unrealistic. We've been doing a lot of research out with general population. I think the people in this room look at a graph and understand what they're looking at. That's actually not typical when you go into a lot of this country. I think also if you look at the wearable devices that Missy pointed to a few times, the fact that most of you have your Fitbit in a drawer at home is extremely typical. It's very unusual for somebody to use one of these devices for more than 12 weeks. And I think that the part that's missing, and I think the part that we're just now starting to do, is really and truly understand what it is that people need and to show restraint in what it is that we're delivering. So to give you an example, people have really clear questions that they need answered in order to live happy, productive, fulfilling lives. So Proteus, at one point, we were creating a few years ago an application focused on family caregiving. So I imagine that many people in this room are caring for an aging loved one, and you're very likely not living with them, and you worry about them. Right? That's a really typical situation to be in. You worry that they're up and about, that they're taking their medication, that they're sleeping okay, that, do they need you? And we created a bunch of prototypes and went out into the field, and we created what our, quite frankly, our engineers were super excited about. It was this app, and it gave you your daily step count and your resting heart rate and how many hours you slept last night, and it was just data upon, it was all of these numbers that people were geeking out about. And we take it out in the field, and family after family looks at me, and they kind of wrinkle their forehead, and they're like, you know what? I just want to know if Mom took her meds this morning and made her usual sandwich at 2 o'clock. Right? So that's a very different kind of question. So we stepped back. We went back to the drawing board, and we created a visual representation that didn't have any numbers, and that very specifically and very deliberately answered the questions: did Mom take her meds this morning and make her usual sandwich at 2 o'clock? Because you could see her pattern throughout the day. So that was an example of us holding back, of not basically putting everything that we can measure out there, but listening really, really carefully to the questions that people are asking and very deliberately answering those questions. And I think anytime you're dealing with data, You have to be out there listening to the specific questions and really answer them. Because if you throw the kitchen sink at someone, or if you give them data that you think might be useful, it's probably interesting for a short period of time, but you're not going to get the stickiness and the persistence that makes a great product. So that's what I wanted to say.
That's great. So, Lena, I know you've had some experience with helping patients understand their data and various different examples that we've discussed in the past. And so would you like to shed some of your perspective?
Yeah, I think I'd just like to echo what Arna was saying about showing some restraint and understanding the difference between doing something because you can or doing something because you should. Now, in our early days at Doctor on Demand, when we were just launched in just a couple of different states, we actually had a feature where patients could access their medical records right through the app. And this was the actual medical record where physicians would take their notes, they would write down what they had, what was involved in the examination, the patient history, and all of this. But it was all in doctor speak. It was all medical jargon, and from everything from the subjective assessment to the objective to the final recommendation. And so all of this was actually shared with the patients. And what we learned is that that was just way too much. People came back with a lot of confusion and a lot of questions, and we just realized, listen, a medical record is something that is written really for providers to capture very relevant information from their perspective and perhaps to share with other providers, but it's not appropriate for patients. They are not obviously trained to understand the jargon or to really understand it from that perspective. So we really scaled back and we worked hard to come up with a different way to communicate recommendations and to have something lasting that patients could come back and refer to. So it was a real lesson learned for us. So I think it's important to really help give something to patients that can really help them understand what it is they're looking at. There's another example that I have where I used to consult for a wireless biosensor company called VitalConnect. They have a biosensor that comes in the form of a patch. It captures a wide range of biometric measurements continuously. It's a fantastic product, excellent technology. Everybody at the company comes from a semiconductor company, so the technology is wonderful, it's clinical grade data, and it is continuous. So it's everything from EKG to heart rate, to respiratory rate, to they have an algorithm for stress, and they can measure posture and things like that. And as they have been testing the product with patients, with consumers, they don't have a companion app that really makes sense of the data. And so what is a patient really meant to do with streams and streams of all this data on all these biometric measurements? And they really realize, we need to take a different approach. We need to be able to partner with a company that's going to make sense of those data and give it to the patient in a form that they're really going to understand and be able to do something with. I think that's really the key. The points that Julie was talking about, it's about generating and consuming the data, understanding the data, and then patients in the end need to be able to do something with it, engage with it, interact with it, make decisions on how they're going to facilitate behavior change, either individually or with their primary care or their providers.
So just to recap some of the sort of benefits that we're seeing with patient data, I think these are amazing points of caution, right? So I think that it's been exciting to see a number of startups learn these lessons. And so while early stage, you have startups like Luminate Health that are trying to make lab data more digestible for patients. You have WellnessFX that's done similar sort of, a better user experience, at least from a UI perspective, for understanding your blood data. And then, of course, in the fitness and nutrition health space, it's been easier, obviously, because it's a little less clinical. But you have companies like, Mango Health, Zipongo, Welkin, Omada Health now is making it sort of this, really great experience. So it's nice to see a lot of the startups that are now learning from that experience. But as we think sort of about, those are all amazing opportunities. And so I wanted to also cover some of the challenges that we may have now with all the patient data. And so, Tamara, I wanted to see if you could share some perspective.
Yeah, I guess I have a little bit of a different perspective, and let me first put on my data scientist hat. And one of the first things you learn as a data scientist, it's not about the data; it's about the interpretation of the data. The data is necessary; it's not sufficient, and I think that's what we've heard from the other panelists here. Consumers, patients may say they want their data. They say, give it to me. I want it. It's mine. Now, legally, that's not true. I'll address that in a moment. But I'm okay with using the term ownership loosely. Fine. Maybe they do own the data. Maybe the data comes from them, whatever. That's great. But that's not really what they want. What they really want, as we've heard from other panelists, is information that's useful for them, that answers their questions, that's actionable. And they really don't want to see the medical records. Now, speaking as a lawyer, I can tell you, having combed through medical records, that there's a lot of good stuff in those babies. You'd be amazed what they'll put in there. And so I can fully appreciate why you might not want to have full access to those. That makes sense to me. So I think some of the challenges are cultural. I think there are certain challenges that are legal. Culturally, doctors may not want to share. Legally, there may be issues about ownership. But fundamentally, I think that the challenge here is finding a way to provide and anticipate what it is that patients want, even when they're demanding their data, and getting that to them in a way that they can use.
So it reminds me of this great skit that Eric Topol showed at a keynote around Jerry Maguire video slide of where he replaces "show me the money" with "show me the data." And so there's clearly a huge patient empowerment movement going on, and some argue about, well, what's causing that tipping point for patients to be demanding their data so much. But now when we think of it from a physician's perspective, sort of building off that first question, what do you see now as the opportunities and challenges from the perspective of the physicians and other healthcare providers to manage this deluge of data and to keep up with the demands from their patients, but also to be able to actually see the benefits of using them for better clinical decision intelligence and for remote management? Arna, would you like to kick that off?
Sure. I'm actually just curious. I know Eileen is a physician, right? How many physicians do we have in the room, actually? So a couple. I just want to know who my audience is, because in my experience with physicians, you don't want to tell them what to do. It doesn't work out. Yeah. And I think part of the challenge with a lot of these tools is that we are enabling some new processes and some new tools for clinical decision making, and some new ways to affect care and provide care. And I think the challenge is that if you as a company are telling a physician that they have to change the way they practice medicine, then you're probably going to fail. You as a company, it's the onus is on you to go out there and understand how it is that physicians work and how they think, and what it means for them to really deliver great care to their patients and deliver tools that fits into that workflow. Not impose upon them the cool latest thing you can do, and say, okay, this is now what you have to use and practice medicine this way. And we have a really great example. Please don't tweet this example, because it's a weird one. So we had a physician in the UK recently who put a handful of his patients on our system and was getting data regularly that he could log into a web portal and look at in terms of and see which patients were taking in real time. Were patients taking their medication? Were they was their rest stable? Were they active? Heart rate, resting heart rate, all that sort of stuff. And we recently had this mind-blowing story, which is that one of his patients tried to commit suicide while he was on our system. And the doctor logged in and saw a really erratic medication-taking pattern. He took a lot. And basically was able to intervene in time and save the patient's life. So pretty amazing. And we were like, wow, shouldn't we create a tool that flags this and brings it up to the surface? And the doctor said, oh my God, no, do not. Whatever you do not create that. I don't ever want to see this data again. And it's because of the liability, because if he were to have missed it, and he had a tool that would have enabled him to see it, he would have been incredibly liable for that patient's death. So it's this really, really weird balance, right? Because it's potentially this very powerful tool, but we have to create it in a way that will fundamentally support and enable the way the doctor practices medicine. And if there are tasks that the doctors aren't able, the physicians, the nurses, let's be a little broader, healthcare professionals aren't able to fit into their workflow right now, we have to think of service models that enable some of that functionality, right? So it's not just about the data. It's not just about applications and visualizations, but it's about this totality of a product that includes services as well, and really using the combination of everything to fundamentally understand, empathize, and fit into the workflows that enable someone to be the very, very best doctor they can be.
So as we think about some of the benefits too, so there are clearly some drawbacks, and then there's some benefits of companies understanding, sort of gleaning off of what Arna is saying, there's an opportunity for improving the healthcare experience for physicians, and understanding and asking, what is your biggest pain point, and how can digital health help? And so you see companies like Augmetics that are realizing that the biggest pain point of physicians using EMRs is not that they don't care for the data in the EMR, it's the actual data entry, right? So why don't we automate that type of a solution? So it's great to see startups that are listening to that kind of feedback, and definitely encouraging to watch. So piggybacking off of that then, Lena, would you like to share your perspective then on how physicians sort of manage the different various points of data?
Yeah, it's interesting because at Doctor on Demand, we work with a lot, we have over 1,400 physicians that work for us across the country, and largely these are more sort of the tech-savvy types, or at least are very open-minded about technology. But I do interact with a lot of physicians who are overwhelmed by what's going on in digital health, and so there's definitely a need to kind of set the groundwork, provide a foundation for these physicians on what digital health is, what sort of the breadth of different types of tools and devices that are out there. And I really believe that coming soon there will be something built right into medical education, whether it's a class or some sort of seminar, but something that's standardized across the US in various medical schools. So just as we take classes in anatomy and physiology and pharmacology, I think there's going to be education around digital health. I think it's going to be critical because these physicians need to know what is out there, what their patients are using, how to interpret the data, how were these data analyzed, and how should they make clinical decisions based on what they're getting from digital health tools. Now, at Doctor on Demand, what we're seeing is physicians having to manage a lot of different data sources. So as an example, we have our own proprietary electronic medical record system that's built right into our app. It's a very simple EMR system, and but it's not yet integrated with other EMRs across the country. We are working on that. We are working to integrate with Epic and Cerner and Allscripts and all of those, but we're not there yet. And so it's really, the onus is upon us working with our physicians to ensure that when consumers and just people come to see us, that we have a way to ensure that there's continuity of care, that we can share that information, and we have a system through which we can sync up electronically or via fax, actually, with any medical record system. It's not done necessarily, directly into the system, but we do work with different with our physicians to ensure that can happen. So it's kind of a challenging space out there, but I think that the more that we provide training and education to our physicians, the better off we're going to be.
Great, thanks. Julia, would you like to share your perspective? I know you had sort of a system approach to thinking about enabling adoption of different services.
Perfect.
Yep.
So in my business, the key stakeholder is the anesthesiologist. And I actually just came from a conference, the Anesthesia Patient Safety Foundation. So leading anesthesiologists across the U.S. And the coined phrase that they stated was, I want smart monitoring or smart alarming. And that was their euphemism for, I want big data, right? So that was their translation. And so they want smart everything. And so I can walk into a hospital. In fact, I was in Arizona last week with APSF at a hospital. Maybe you know a couple of them there. And I had a very enthusiastic and passionate anesthesiologist that wanted to talk about smart monitoring and smart alarming. And I could actually get him to inquire and evaluate and perhaps purchase my system. Similarly, 2.5 weeks ago, I was here and I talked to the VP of Innovation, and they wanted smart monitoring yet again and smart alarming. And I could ask him to dig into his VP of Innovation budget to drive some sort of pilot of our technology. But I don't actually think that's where we're going to drive adoption of big data or smart monitoring. It's actually in the context of what I would say is three things. So number one is, how does a hospital actually make money? Or how does the care continuum actually make money? It's actually quite surprising thought. Or really the reverse, which is, how am I actually saving money or reducing risk or reducing liability so I don't have the cost implication to my total system? And I think we have to think about that in the context of bringing our devices and solutions to the market. In addition, earlier this year, I conducted a market research analysis. It was 150 C-suite individuals across the US. And what was incredibly the key theme through the whole research is, and I'm going to state it, if I do more, or if I know more, then I'm going to have to do more, and I have to do more with less. So the key here is, again, how do you provide them a solution that thinks about the care continuum, but also resides on some key themes of how do I make money or how do I save it? And so I wanted to state that right now because all the panels that I've been a part of over the past couple of months, one of the biggest nuts to crack is the evidentiary support to get the return profile, to drive the need for data integration, data fusion, data translation into meaningful action. And I don't think that today, and maybe this is a call to action for all of us, there is enough evidentiary support. There's a lot of testimony, but there's not enough evidentiary support to really drive after that risk sharing for large companies, or take on those different business model approaches. And one to note, there was a very, very large CHF study that actually was done with a Palm Pilot that, if you can even imagine, and it was a randomized control trial that actually failed. Telemedicine, it actually proved worse. So when we talk about, again, the financial benefit and or preventing the implication, it's really that support that we have to work together on to make sure that we can provide the right business model to create value.
Tamara, would you like to share some of your thoughts on both the opportunities and the challenges that you see from a physician's perspective?
Yeah, so I am a lawyer. Usually people say I am not a lawyer. That's kind of what I hear most often. But yeah, so I am a lawyer, and there are issues of professional liability here, and a data dump is not going to do anything to reduce risk in that regard. It's perfectly understandable that doctors do not want to have exposure to information that they are unable to process and use in a reasonable manner. You can't blame them for that, and in fact, we should admire them for that because there is risk there, and there's a real potential for lawsuits and other problems. The other element, though, of this issue is the privacy one, and we've heard about that a little bit today, and I think most of the people in this room, at least at some level, appreciate that, and this is not legal advice, but just a caricature. HIPAA requires encryption, probably more than that, but there are issues with transmission of data and privacy, and these laws are created to protect the individuals. So we have laws in place. They're intended to protect the doctors. They're intended to protect the individuals. And the reality is that sometimes they just get in the way of getting things done. And I think that's what we're seeing today. And some of it is justified, some of it maybe not so much. But I'm going to say the same thing I did before, which is, the data is necessary, it's not sufficient. What we need are interpretations and tools that people can use, and that applies to doctors as well as patients.
Thank you. All right, so our final question, at least from me, is sort of connecting this back to the theme of the conference, right? So medtech in the digital age. And so as we're sort of looking at the future, last panel of the day, what do we sort of leave the doors with? Would be great to inspire everyone to be thinking about product innovation and really pushing you to think more around digital health with medtech. My own experience at Medtronic before I left was actually looking at that intersection of digital and product innovation and looking at things like smart stents, and inspired actually very much by Proteus in what they were doing and how we could start innovating in that space as well. So as we look ahead, and try to end this off on a futuristic note, I'm curious to see, as you push yourselves and your companies, what are the opportunities and challenges medtech companies face in leveraging patient data to innovate their products and services around digital health? And Arna, kick it off.
Sure. So opportunities for companies are to completely change the way that you monetize your business. If you look at the pharmaceutical space right now, it's really archaic that in some ways, you get paid for drugs that you dispense, and more than half of them get flushed down the toilet. There's trillions of dollars of benefit that isn't realized because people aren't taking their medication. So if you think about it from that perspective, what if you as a company were to actually monetize for drugs that, maybe only drugs that are taken, or to be even more provocative, maybe only drugs that actually have a positive outcome, right? So you get paid a lot more for that, but you get paid when your product actually works as opposed to it going into the toilet. And I think that anytime you have data streams, it enables you to think about your business in a completely different way and to come up with monetization strategies that are completely different than what you're doing today. And the companies that do that right are the ones that are going to win. And I have a really good, tangible example of that. And I kept my mouth shut during Missy's panel earlier this morning because I promised Harveen I'd tell this story now. But another, a really interesting way to monetize is essentially, we talked about risk sharing this morning, is again this charge for a different thing. So Merck Serono in the UK, a number of years ago, had a pitiful market share on its injectable drugs. And so they started looking at increasing their market share in, I think it was human growth hormone as the first one. The actual drug doesn't matter because they later applied this philosophy across all their injectables to really good results. So basically what happened is they had a market share that was in the single digits. It was terrible. They were priced about the same as all their competitors. And they had a new GM come on board. And he basically is looking around the company, how can we change this, revitalize it? He actually turned the UK franchise into a digital health company. And they had a digital injector that was sitting on the shelf. So basically this injector was able to capture precise time and dose of every ingestion that was given. And so he took it off the shelf, he brushed it off a little bit, and he then deployed his injectable medication with this digital injector. And there were a number of things that happened. So first of all, he was able to see exactly when he was losing customers. So because of that, he was able to create very, very targeted programs that intervened at just those moments and kept people on the system at just the right time. So he had data to essentially keep people using a product in a way that was more effective for a longer time. So that's one thing that happened. And the second thing that happened is even more profound. So because it was a digital injector, he was charging a lot more than everyone else. And yet, within within a fairly short period of time, his market share kind of looked like a Dilbert cartoon, with the hockey stick that goes all the way to the top in like the high double digits. And essentially what happened is, and he said, look, NHS, and granted there are huge advantages to a single payer system, but the principles probably will translate to some degree. He said, look, NHS, I know that you pay a tremendous amount for these medications, but why don't you stop paying me for the drugs that I dispense, and why don't you just pay me for the drugs that are actually taken on time correctly? And the NHS said, yeah, that's a great idea. We'll even pay you more for that. And so even though he had a much higher cost product, the NHS actually went ahead and changed its policy to require that a company is able to verify correct usage of a biologic, and they were the only company that could do it. So their market share became a Dilbert cartoon. And it's all because of digital information, right? And having data around that act of engaging with your healthcare and using your therapy. So huge potentials that are, we're just scratching the surface. We're at the very tip of the iceberg of what it is that we can achieve now that we can actually measure.
Lena?
So I think the beauty of working at a digital health company is that there are some very quantitative ways to capture information, and I know that we at Doctor On Demand make changes to our product and our approach and sometimes our strategy based on the information that we gather from patients. So as an example, we obviously can track all the different reasons why people use our service. Everything from coughs, colds, to flus, to GI issues, to asthma, to rashes, to whatever else. And it's really helping us guide our roadmap. So say, for instance, if we felt that we were seeing an overwhelming number of asthma cases, we could consider adding on and perhaps expanding our medical practice to include pulmonologists. Or if we were seeing a lot of rashes, we could perhaps add dermatologists. And I think it's it's a way for us to guide our roadmap, to perhaps add on some complementary services like producing educational materials for patients and things like that. But I also think there's a lot of qualitative data that we receive through just text feedback that people provide us, to some of the inbound requests that we get from actually the enterprise audiences. So as an example, what we've learned is that so far, if you look at companies that have more than 1,000 employees, about a quarter of those offer telemedicine as a benefit to their employees. And that will increase by another 25% in 2015. So, whether or not providers are ready for it, this is something that is coming, and we know that we need to work with employers to ensure that we can give them a product that's going to be highly utilized by their employee populations and is going to produce ROI for them. And I think, another area where we can use these data is to influence things like policy change. Because I know that there are a lot of state medical boards that are still kind of on the fence about how they feel about things like telemedicine. And if we can produce data showing that we can resolve a very high percentage of our calls through video visits, that we have good outcomes and things like that, I think it's a way to demonstrate that there's value in what we do and that they should adapt their policies accordingly.
Great. So as we think about some of the bigger companies, and thinking even back to an article that came out from Medtronic this week about looking at sort of the future of body computing data and distributed model of medicine, and just sort of thinking about Google's Moonshot project and companies getting excited about generating data not only to help improve outcomes for patients, but also to help guide their next generation product innovation. So Julia, if you'd be able to speak from Covidian's perspective, you know, what are you guys looking at in terms of both opportunities and then also challenges to execute on that vision?
Yeah, sure. So our franchise is actually interpretation of big data. It just happens to be patient data that's time sequenced and normalized to derive a physiologic measurement like arterial saturation, or SpO2, or EtCO2, capnography. It's a measurement of exhaled breath. So for 30 years, our organization actually has been using patient data to generate monitoring modalities to drive positive clinical outcomes. One of the things that becomes a challenge to us, so I'll talk about that first, is actually the time it takes to do it. So to bring the patient information in, to make sure that we're normalizing the data, time sequencing it appropriately, asserting that we're meeting some, kind of benchmark or best practice of measurement, and then doing it in a means in which we can get it verified and validated so we can have a regulatory approval to actually bring it into the clinical environment. So one of the biggest challenges is actually time and the correct patient population and the breadth of patient population. Any of you have done statistical analysis? You can have many patients to try and drive a safety and efficacy of performance, and you'll always have corner cases, always, where you are going to find something odd or new. So it's truly a challenge, and given the variability of where the FDA actually is today, and we're seeing stronger and stronger restrictions. We're driving submissions, getting a lot of questions back, a lot of questions. We do, pre-510K, et cetera, activities, and we're still getting a tremendous amount of questions back. And in fact, my team today is working on one of those, those question sets. Turning it all around, I actually really agree with Arna, and the opportunity that exists is this new business model and this new face of what you're actually bringing into the healthcare system. And so when we think about it in our franchise, we think about it actually as a Venn diagram of 3 parts. So it's really the process. So we talked a lot today about business process optimization, so really understanding people's workflow, using lean principles, Six Sigma, et cetera, to really understand the management and streamlining the system. Second, we talked a lot about behavior, so change management. So, I drive, if any of you have ever driven from Denver to Boulder, there's 2 major highways, I-25 and I-36. And I literally do not know any other way to get to Boulder. And there are probably 15 or 20 ways. But that's change management. I have to teach myself, I have to grow, I have to understand that there's a new process that might be efficient. And those are just two legs of the stool. The final thing is really now bringing in the technology to create that enhancement approach. And that really gives you the 3-leg of the stool, where you can create a lot of new business models, but also solutions that are fundamentally embedded within the healthcare system, as opposed to kind of sticking out like a sore thumb. So, thanks.
Thanks. Tamara, would you like to share some of your perspective?
I'd just like to say that it is just amazingly cool what's going on right now.
Yeah.
I mean, am I right or am I wrong?
This is coming from the lawyer, so.
I look around me and I see what people are doing. There are so many creative ideas, amazing ideas. Okay, maybe they're not all amazing. There are so many ideas out there, though. Creative, there you go. They're all creative. This is the time. This is what's so exciting, because right now the real challenge is to take off the blinders and allow yourself to think creatively, to be the innovator, to be the inventor, to change the system, to come up with new ideas. And that's not just to keep me in business, although it doesn't hurt. But really, I do think that this is the time when we have a point in the development of the technology when we are fundamentally enabled to do new things. And it's up to us to figure out how to do them. It's not a burden, it's a challenge. And I just look forward to seeing what everybody's going to be doing. I really do.
Nice. Very nicely put. So I know we only have a few minutes before cocktails. I'm sure everyone's itching for. But we have a couple of questions from the audience, so I'll just read them out. One that got highly voted is around, we have talked about benefits of collecting patient data, but what about the flip side, where privacy is invaded and has potential to be used unfavorably to the patient? And so I'm thinking this means more, the anxiety around what that tracking data could do from who else has access to that patient's data.
I mean, I can address that a little bit,
Sure.
and I'm sure that the other panelists will have specific examples, but the privacy laws in the U.S. are very stringent, especially in California. They're even worse here, or even better, depending on your perspective. They're intended to protect people's privacy and to protect them from themselves. And the reality is that what we're seeing with a lot of the new wireless apps is, a sharing of data that people don't really appreciate. And we see this even in sharing of genomic data. Some of you may be familiar with the recent study in which they were able to back out identities based merely upon a person's last name. So smart people can figure things out, and there's a lot of information out there, and there is a real risk. There's a real risk that that data can be used and can be used to someone's disadvantage. We saw it with the hacking of the cell phone data. So, is that a fundamental impediment to what we're seeing in this space? I don't think it is. I really do think this is a time when we all just need to take a deep breath, take a chill pill, as some might say, and not kind of go overboard about this. That's just kind of my personal perspective. The other element, though, in addressing it is the IT systems. And I do think that in 5 years, what we're going to see is an infrastructure that is set up in order to provide greater security and sufficient security to enable the kind of sharing of data that we really need in this domain.
So, this question's asked every single time I think any of us are on a panel, pretty much. It's a pretty typical question, and it's one that is a little bit mind-boggling, because how many people in this room use a credit card? Nobody uses a credit card?
Admit it.
Okay, a smattering of you use a credit card, so fine, it was rhetorical. But Visa knows with extreme accuracy that you're going to get a divorce 6 months before you get a divorce, right? You don't even have to tell them. Target knows that you're pregnant before you even know that you're pregnant. The fact that the amount of data that people are collecting about you because of your financial transactions is kind of mind-boggling, and has the potential to do incredible damage if it falls into the wrong hands, or if it's misused. And yet every single one of us engage in these transactions on a daily basis. And what that comes down to fundamentally is value, right? So using a credit card is a much simpler way for you to make financial transactions than carrying around, cartfuls of cash. And we're going to see the same kind of value exchange happen in healthcare. So as soon as you start getting real value and fundamentally making people's experiences and outcomes in the healthcare system better with data, this whole conversation is going to stop. Because it's stopped in the financial world. And I predict we're going to see the exact same trend here.
Any other perspectives?
Yeah, I think I just have a comment to make about, or sort of a thought to contribute, and that is that I do wonder, I think it remains to be seen how patients are going to react to things like Apple's Health Kit or Google Fit, these places in the cloud and online where you can end up storing your data. And I know that those companies have big hopes for those things, but I do wonder what sort of the mass markets are going to, how they're going to react to that, whether they're going to find them useful, scary, and whether that will raise, obviously, huge concerns about privacy.
So the only thing that I would add is I was actually at the Connected Health Summit last week, and interestingly enough, ADT is in the health delivery information management system. So when you talk about a organization that you would think as, security management, well, they're in the health information age already. And in fact, one of the panelists during the conference was Lowe's. So the smart home, the smart house, they're already delivering information that knows a ton about you beyond that of your credit card. It's how you live your life, how you're moving, how many times you're opening the refrigerator, etc. So, and I do it a lot.
Yeah. I open the chocolate drawer a lot.
But the fact of the matter is that we're already deploying the technology, as Arna is saying, as the panelists are saying, we're already deploying the technology that is giving people access to a lot of information. I mean, like Track My Jog or Track My Ride or, all the different applications, they're already doing it. I think it's the really the smack of when you see it in front of you and you see your data, or you, just like your credit card company says, your credit card has been compromised, that's going to be the first revelation of what is going to transpire. And that's, I think, at the tipping point of what the industry actually does, is when you actually have the first hack system.
Yeah.
So before I go into the last question, I'm going to give a big plug for this app. I love that all the questions are streaming in, and I can see them, and I can see which one's highly voted. So very digital. Thank you to the organizers. Love it. And that's also encouragement for more of you to contribute questions if you'd like, as I'm running through a few more. So another question is, if med device companies can receive so much patient data, are there also tools being developed to help them identify and manage complaint information in that data?
So,
And I can ask for clarification from the person who wrote the question.
I mean, it's interesting. I was at speaking at a panel recently, and what came out was that companies, like some of the big traditional players, were scared to death of actually using any of these technologies because they were afraid of what people would type into any sort of forums. And if you talk to any kind of pharma company who's trying to develop an app, you'll notice that there's absolutely no free entry. This whole like fear of uncovering adverse events and uncovering complaints, it's kind of mind-boggling to me as well. I mean, I think one of the biggest fears that companies have about Proteus, the big established companies, is that we're actually going to show when their therapies don't work, and that really, really, really scares them. And it kind of goes along with this constant fear of hearing about adverse events and complaints and whatnot. I'm sure that there are companies out there that can help streamline the complaint management process. I think more interesting is what happens when complaints are embedded inside of the data that you capture.
So that's a great question. Thank you for that. I think, I do find it a bit scary. And I know that when we first launched, it was a little overwhelming, to think that you are basically getting all this very public feedback because you can find our app in the App Store and in Google Play, and you go there, and now we have thousands of reviews, and most of them are good, but there are some ones that are negative, just like any review, and it's all out there for people to examine. I have to say that there's sort of that aspect of it, but also what we do with our service is that we give every user the opportunity to provide feedback after every call, and they can either rate us on a 1 to 5 star rating. They can also provide text feedback, and we have chosen to manage this really on a case-by-case basis. It's very labor-intensive, but we feel that it's worth it. So any user that rates our service less than 4 stars will get a call from our customer service team. And because we want to resolve and understand and resolve every single issue that is raised, and it's a way for us to stay connected with our users and to really understand the core of those issues, and to use that information to get better as a company. But I have to say, it's humbling. We relish the positive reviews that we get, but we take the negative feedback to heart.
Thank you. All right, so there's one other question, only because it's highly rated, and then I will get to the audience as well. And the question was, assume you provide the patient or physician the digital health information and the way they want to see it. what is your expectation they will take the action the information suggests? How do you invent, motivate, ensure that this happens? And before I actually turn it to the panelists, I'd actually like to share a few examples that come to mind myself, actually, and again, excuse them because they're all startups, but I'm seeing companies like Ginger.io have the physician and the patient. So Ginger.io essentially does passive monitoring from the data from your phone and the way you're using it, and it's initially focused on mental health to be able to sort of, with predictive analytics, to be able to do sort of similar to what Arna had described earlier. But the way they're trying to ensure adoption is that the physician, prescribes it to the patient, and the patient actually wants to, lock in. And so both of them have agreed to this relationship and agreed to tracking that data. And the way they sort of try to visually, they've made it appealing. It's a check light system, green, orange, red, where you sort of you can track yourself how you're doing. And the background is the guys are more from a mobile background and had been seeing how you could track all this behavioral information about people for financial transactions, et cetera, and started thinking, how about if we start applying this to health? So I think they've been pretty successful in ensuring adoption of their system. And then other companies, there's several companies that come to mind. Mango Health happens to just be top of mind because I saw them recently. They come from a gaming background, and they're just trying to gamify the experience. Zamzi is doing it for children with obesity. So there are a lot of companies that are in the health space and health tech. I'm noticing folks coming in from a complete tech background or a gaming background, just folks who, or just sort of a user experience perspective on how do you just get more users to adopt something like it's a cool technology versus a cool health product. So those are some examples that I've just seen from VC, but I don't know if anyone has any more to share.
I'll mention a company that I think has a really interesting model, and that's App Medicine. Lisa Serwin is the CEO, sitting right there. And it's basically, App Medicine has a set of tools for physicians to really stay in touch with their patients. And if I'm correctly representing it, I mean, it's anything from store and forward technology, sending photos and things like that, but it's also texts and different messages that physicians and patients can use to communicate. And I think that is extremely useful because it increases the frequency of those touch points, which is so important when it comes to facilitating behavior change, checking in with patients, ensuring are they following the treatment protocol and recommendations, and it's a way for providers to help their patients kind of keep that treatment protocol top of mind.
I did not pay her for that, by the way.
Nice. All right, so I'll open it up to the audience. I know we only have a few minutes, or we need to wrap up at some point, but I'll look to someone to give me a signal up until then. But are there any questions from the audience? I did see a hand go up earlier. Did you still have a question? Okay.
People want cocktails.
I know. I think people are nervous that they'll get glaring eyes from others for asking a question at this point.
No.
Okay, well, I'd like to, if there aren't any questions, let me know if I'm missing anyone. But if there aren't any questions, I'd love to thank the panelists. It's been amazing to work with you. And to the MedTech women organizers.